Hello, everyone. Welcome back to Einstein's Eyes, where we dive into the world of healthcare, wellness, ophthalmology, and other medical topics. So I'm your host, Carl Rosen. I'm an oculoplastic surgeon and neuro-ophthalmologist, fellowship trained in Pittsburgh, now in Anchorage, Alaska, where I've been practicing for 30 years at Ophthalmic Associates. We're going to venture into a topic today that combines beauty and well-being, aesthetic care. And I'm going to introduce Merissa Scott in just a second. But first, Jon, say hello.
Hi, everyone. I'm Jon Didkoff. I'm an ophthalmologist in northern New Jersey. I've been doing this for 30 years, specializing in cornea. Carl and I met each other at Albert Einstein, where we did our residency, hence Einstein's Eyes. Glad we get to connect once a week to do our videos.
That's right. That's right. Jon, thanks. Great co-host, great friend. And he was a great resident, way better than me. Joining me is someone I had the pleasure. So I met Marisa at Geneva Woods Surgery Center, where I do my surgeries, I do my oculoplastic surgeries at. It's a great surgery center in Anchorage, Alaska. I have retina partners and ENT partners. But Marisa was a stellar post-op recovery nurse, and she's really making waves in Alaska in the world of aesthetics at Aspire Medical Spa, you can see in the background there. So let's welcome Merissa Scott to the channel. Marissa, it's great to have you here. Just tell the audience about your background as a nurse and how you got started.
Thank you. So I have a few aspects to pull together. I started back in about 13 years ago on a plastic surgery team. And that's where I really got the medical side, my introduction to the operating room and aesthetics as well. They ran the plastic surgery group, but they also had a medical spa. I started working for them as a CMA and a scrub, and I fell in love with it. You couldn't get me out of the procedure room. It was something that I really, really enjoyed doing, from traumas and reconstructions, breast cancer. And that was sort of the introduction of tying that wellness and aesthetics together, helping people with their cancers and their traumas, but also reinstilling that confidence back to them. And then I was with them for almost 7 years, and I went back to school just because I kind of hit that maximizing my scope and I really wanted to do more. So I left that practice. I went to nursing school, and then I came out of nursing school and started doing a lot of general and trauma surgery. Fell in love with that, but with that was a lot of stress. And so I got my foot in the door doing aesthetics part-time, just to de-stress and bring kind of pleasure and passion back into the field that I was in. And I fell in love with that. So along with that, I became a certified first assist, where I started specializing with the spinal team in orthopedics and again, plastics, doing closures. And with that came a lot of scar revisions. So again, I kept looping around between the medical and the aesthetic side and really connecting how they complemented each other, how their relationship was really symbiotic. And that's a big focus here at Aspire as well, is we're not just doing facials and fillers and Botox. Don't get me wrong, we love those, but we really dig into the why and the underlying science behind why people are feeling how they're feeling, how we can correct those, but yes, also make them look aesthetically appealing as well. So we do a lot of scar revisions here, bring in a lot of cool science-based practices like RF microneedling, all kinds of fun stuff, injecting some steroids for thinning those scars out. And then also some symmetry stuff. I think we've sent quite a few patients over to you as well for, again, when we think aesthetics, we love to start with the eyes, right? It's the gateway to our soul. A big chief complaint with that is people come in and they have big bags. They're like, my eyes are heavy, they're dark, help me. Usually there's an underlying reason to that though, right? They need a blepharoplasty, they need more sleep, they have allergies, they're wearing contaminated makeup every day, fake eyelashes. And so that's where Aspire really, we start with that assessment. You know, why do you have these problems? We can throw a bunch of dermal fillers in and make you look great, but that's not something that's really going to fix the problem, right? So we really take pride and pleasure in recognizing the problem, fixing that, and then making people feel good and kind of treating that more superficial underlying stuff.
Yeah. So Marissa, that was great. Thanks for that explanation. So you worked with a great guy that I knew, and he's retired now, Mike Manuel. He was a great plastic surgeon here in Anchorage. So I know you got a great foundation, and you worked with other great surgeons as well. So you touched on it a little bit, but what sets Aspire Med Spa apart from other spas in Anchorage, and what kind of treatments and services do you offer?
I think what sets us aside is we really dive deep into lifestyle. Where do we need to start with the overall picture? So we do a ton of counseling here on, do we drink alcohol? How does that affect our face? How does that affect our blood pressure? How does that affect our face? What does our weight loss look like? We really do a lot of, I don't want to say primary care, but essentially that is what it is. We're bringing people in, we're doing weight loss management, we're doing sexual libido clinic, we have a hormone balancing clinic. Our weight loss program, just bringing down someone's BMI and cleaning up their diet and getting them off of alcohol and counseling them on cigarettes. I mean, that right there, without adding aesthetic practices in, will age someone backwards 10 years. We all know what those things, the havoc that they wreak on our body. And I think that's where we're special. We have a nurse practitioner on, and she really dives deep into those components, balancing the body, getting that equilibrium all back together. And then we have an amazing aesthetic team who takes over after that point, and does the final touches.
Things about it. So some people might think aesthetics is all about vanity and beauty, but I know from experience and what we've talked about in the past is how important it is for people to feel confident. So how does the role of Aspire or just aesthetic care in general affect someone's overall well-being?
Yeah, so I think it depends, again, back to that, the chief complaint. So one thing of many examples that we're really getting well known for is post dog bite trauma. And that is something where, I have women coming in all the time, and their friend or their family drug them in here. They've steered clear of med spas their entire life. You say Botox and they want to hide. But it's that education and exactly what you said about setting aside vanity and aesthetics, right? So we do a ton of Botox and fillers where you would look at this gal or gentleman and never know that they had work done. And to me, that's really rewarding, right? We're using it for symmetry. We're using it to correct a volume deficit or soften scar tissue. And they leave with confidence again, but they don't leave looking done. And that's something that I really enjoy and take pride in. I love using the aesthetic world to rebalance them and exactly what you said, instill that confidence without making them feel vain or even have to ever expose that they had work done. I think that's where the real art and science blend together, is how can we give you confidence? How can we make things look good again without making you look done, right? That's the end goal for some of that.
That's great. So what other stuff? I mean, do you do just massages for folks that have say a stiff neck or shoulder injury? I mean, how far what's the sphere that you capture?
Yeah. So we do facials, we do chemical peels, we do a lot of RF microneedling of various different kinds, from trauma to aesthetics and cosmetics all blended in there. We do a lot of laser treatments, different kinds of lasers. So rosacea, pigmentation, resurfacing. We use the laser for permanent hair removal. That's a really common service for male and females. We have a lot of different kinds of fillers that we use for different things, a lot of different neurotoxins. Again, we use for cosmetics, as well as, medical correction grade stuff, headaches, the scar revision, symmetry stuff. Yeah.
Wow.
The world is our playground. Like I said, we do the hormone stuff. We have started two really fun procedures: vaginal rejuvenation, which started for like pelvic floor tightening, urinary incontinence treatments for those women, which is huge for postmenopausal, and it's also huge for marriage therapy. I mean, that's something where no one wants to talk about it, but I can't tell you how many couples come here together and they're like, "This has changed our marriage." To me, that's super rewarding. I love that kind of work. With the hormone stuff, people who, they haven't slept together in years and now they're having a sexual relationship again. they are remembering the reasons that they fell in love in the beginning, rather it's, ED or the vaginal rejuvenation. And then we've started doing a lot of sculpture work. So we're doing like liquid booty augmentations. I love it. There's not the risk of traditional BBLs with fat emboli. The BBL, the Brazilian butt lift, where they're doing liposuction and re-injecting that's the highest fatality rate of all plastic surgeries. And we're doing it in an outpatient setting with, I don't want to say no risk, because we all know everything has a risk, but very minimal risk. People are returning to work the same day they're getting this procedure done. It lasts several years. It's a fraction of the cost. It helps improve skin quality and volume, and women who maybe have a BMI where liposuction is not an option to them, but they still have a little bit of that body dysmorphia where they don't have a lot, but we're still able to help them, and we're meeting their need, right?
Wow.
So I love those unique treatments that aren't available at every med spa on the corner.
Wow.
Our background and our team is pretty diverse, and I think that brings a lot to the table.
So who was part of your team?
There's my medical director. She's a huge part of the libido, sexual health, weight management. She is also responsible for dictating our treatment plans, signing off. Medical director Catherine Hardy, nurse practitioner. There's myself. I'm a registered nurse first assist, and I do most of the facial injections, a lot of the vaginal procedures, and a lot of the scar revisions. And then we have a medical esthetician, Elisa. She's fantastic. She's just has good feng shui. She does our facials. We had a massage therapist, but we just discontinued that just to demand for the clinic space. So that might be something that we do in the near future here, is expanding just for room. And then we have a patient concierge and a front desk receptionist. So it's pretty good.
You're really
Yeah.
growing. Holy cow.
Yeah.
So John, what do you think, John? Do you have
Yes, I have a couple of questions. So number one, some of the things you mentioned are covered by insurance. Some obviously aren't. I mean, do you participate in insurance?
I don't. It's something that we've really explored, and in the end, we have decided against it. I have several peers that have practices that bill insurance that are my competition. I gladly send patients to them. We have a great chiropractor office over at Denali Injury and Spine. They bill insurance for Botox for the headaches, or hydrosis, all of those things. So we've decided to outsource those cases, or we do the self-pay for them.
So like the things like vaginal rejuvenation is not covered by insurance?
It's not, but that is something that recently became FDA approved. So that's something we're watching very, very closely. Our team is exploring right now on how to coordinate those referrals and how we can get creative with maybe pushing that through. And I think it's something we will start probably here. Just a guess would be sometime in the next year. We've had several physical therapists referring clients to us, and they're super happy with results. So they're all about, how can we help you? How can we, write letters and referrals to support that? So I do think that's coming, but we're not there yet.
So I was listening to your team, and I mean, you have yourself, you have a nurse practitioner, the director's a physician, or no?
She's a nurse practitioner.
So there's no physician in the med spa?
Not at this time. Mm-mm.
Yeah, that's really interesting.
final thoughts? Anything you want our audience to know?
I think my biggest advice to everyone exploring aesthetics and wellness is the education side of it, right? Get educated. What's bothering you? Know why it's bothering you, and get the right team to fix those things, because a lot of times it's not, seeing a nurse or an esthetician for under eye filler, right? It could be that blepharoplasty. It could be that hypertension. So I just encourage everyone, do your research, find out what it is, why it is, and make sure you've got the right team to fix it, to maximize that efficacy, because that's what it's all about.
Right. And the fact is, you're well connected, you're well networked. Your Rolodex is pretty extensive because you've been in the medical community. So, you have somebody like me, oculoplastics, you have ENT, ophthalmology, other specialties.
I think that's something people really respect about us, is if we don't feel like we can at least match, maybe not even surpass their expectations, we're going to connect you with the right people. We're going to get you in the right hands that are going to be able to fix what's actually going on. And I think that alone is we have a 98.7 client retention rate, meaning 98.7 of all clients who've ever come in here have at least come back once or twice or are coming up in the near future. And I think that that's something really special to me because that's a quality care thing. We don't bill insurance. People are coming here because they want to be here. They're coming here because they're seeing results. And I think clients feel when you really care and we're saying, no, we're not going to put filler in, or we can't fix your problem, but I know someone who can. And a lot of times we'll reach out and make those consultations for them while they're here in the spa, and people appreciate that little extra step. I think that's the difference of caring and wanting money, and that wellness ties in, right?
Right.
What can you do for Carl? What can you do to make Carl look good?
I'm hopeless, man. I'm hopeless.
No one's hopeless.
I don't know.
Challenge accepted.
Sorry, I really liked your summary, but I do have one more question. So you mentioned health and diet. I mean, so are you able to prescribe medications like Ozempic without a physician? I mean, the nurse practitioner can do that, or do you refer them back to a doctor for that?
Our nurse practitioner. So nurse practitioner rules are very different state to state. And I meant to answer this question when you were asking about having a physician in-house or not. So in the state of Alaska, nurse practitioners can prescribe, they can practice independently.
Okay,
that's for us.
Why? Yeah, thanks for the clarification.
Yeah, so for us, it makes sense to have a nurse practitioner. Obviously, if she wasn't able to meet our needs with those things, we would have an MD in-house because the things we're doing, they do need a physician or a nurse practitioner. And I think, again, it's really important to have someone like that supervising care. I haven't gone to full on medical school. I'm not going to even pretend like I'm educated to the level of what she is and what she's doing. And I really have value for that. And same thing with my esthetician. I tell her all the time, I don't do a lot of facials because it's not my specialty, right? It's not my scope. I'm not a very soft feng shui girl like she is. So I think that goes all the way down the chain. But yeah, our nurse practitioner can meet the needs of prescriptions.
Yeah.
And we do a fair amount of prescriptions through, the sexual health as well. We do use semaglutide very lightly. Our maximum dose is usually most practices' starting dose. And that's because we require patients to come in every single week and talk about their diet and talk about their alcohol intake and talk about their, what are they doing activity-wise and exercise-wise, that accountability check. Sure. So she's a very big part of our practice.
State by state scope of practice is sort of dictates what the spa can do. Thanks, Marissa. Thanks for that. I think our audience will get incredible value learning about what Aspire does and what you've built. And, we look forward to having you back and talking about more about health and wellness and aesthetics. But thanks for tuning into Einstein's Eyes, everyone. If you enjoyed this conversation, please give us a thumbs up, subscribe, share, whatever you'd like. And just to reiterate, Aspire Med Spa, Merissa Scott is in Anchorage. If you're looking for expert aesthetic care, be sure to check out Aspire Med Spa. Okay, until next time, guys. Thanks. Thanks, Marissa. Thanks, Jon.
Thank you.